Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Mannitol Infusion, exploring the various aspects of mannitol, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Mannitol Infusion. Mannitol infusion is commonly used in medical settings for various purposes, primarily for its osmotic properties. Let's discuss some of its main uses. Mannitol is often administered to reduce intracranial pressure in conditions such as traumatic brain injury, cerebral hemorrhage, or brain tumors. It can be used to lower intraocular pressure in conditions like acute glaucoma. It is also employed to prevent acute kidney injury during procedures that might compromise kidney function, such as surgeries involving the kidneys or contrast media administration. In cases of poisoning or overdose, mannitol can be administered to facilitate the excretion of toxic substances through the kidneys. Next, dosage of Mannitol infusion. The dosage of Mannitol infusion varies depending on the patient's condition, weight, and the specific indication for which it is being used. Typically, mannitol is administered intravenously at a dose of 0.25 to 2 grams per kilogram of body weight over a period of 30 to 60 minutes. However, the dosage may be adjusted by the healthcare provider based on the individual patient's response and the desired therapeutic effect. Next, mechanism of action of Mannitol infusion. Mannitol exerts its therapeutic effects through its osmotic properties. When administered intravenously, mannitol is not metabolized by the body and remains in the bloodstream. It is an osmotic diuretic, meaning it draws water into the kidneys, increasing urine output. This effect helps reduce intracranial pressure by decreasing cerebral edema, lowers intraocular pressure by reducing fluid volume in the eye, and protects the kidneys by increasing renal blood flow and promoting the excretion of toxic substances. Next, side effects of Mannitol infusion. While Mannitol infusion is generally considered safe when used appropriately, it may cause some side effects. Excessive diuresis induced by mannitol can lead to dehydration, electrolyte imbalances such as hyponatremia and hypokalemia, and volume depletion. Mannitol infusion can cause hyperosmolarity, especially if administered rapidly or in high doses, which may lead to complications such as hypernatremia and hyperosmolar coma. In patients with underlying heart failure, Mannitol infusion may exacerbate fluid overload and worsen cardiac function. Although rare, allergic reactions to mannitol, such as hives, itching, or anaphylaxis, can occur. If mannitol leaks out of the vein during infusion, it can cause tissue damage and necrosis at the injection site. Next, important advice for using Mannitol infusion. Mannitol should be administered cautiously, with close monitoring of fluid balance, electrolytes, and renal function. The dosage should be tailored to the patient's individual needs and adjusted based on their response to treatment. Regular assessment of renal function, including urine output, serum creatinine, and electrolyte levels, is essential during mannitol therapy to detect any signs of renal impairment or electrolyte imbalances. Mannitol should be infused slowly over the recommended time frame to minimize the risk of adverse effects, particularly rapid changes in osmolarity and fluid shifts. Special caution is needed when using mannitol in patients with pre-existing renal impairment, heart failure, or electrolyte abnormalities, as they may be more susceptible to its adverse effects. Healthcare providers should carefully monitor the infusion site for signs of extravasation, such as swelling, pain, or tissue damage, to prevent potential complications. Patients receiving mannitol infusion should be informed about the potential side effects of treatment and instructed to report any adverse reactions promptly. They should also be advised to maintain adequate hydration to minimize the risk of dehydration and electrolyte imbalances. Mannitol may interact with other medications, such as diuretics or nephrotoxic drugs, potentially increasing the risk of adverse effects or altering their efficacy. Therefore, healthcare providers should review the patient's medication list and consider potential drug interactions before initiating mannitol therapy. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using Mannitol infusion. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.